Today, we are going to be hearing from Dr. Stephen Cantrell. And Dr. Stephen Cantrell is an optometrist from St. Louis and also a member of the SOFT Medical Advisory Board. Dr. Cantrell received his training from the University of Illinois College of Optometry in Chicago, Illinois. And he and his wife, Peggy, have two children, Ryan, who had trisomy 18, and he's now an angel, and also Lauren. Dr. Cantrell has been involved with SOFT for probably longer than he would care for me to mention. He's on the SOFT board, and we always appreciate everything that he shares with us and our families every year. Thank you for being here, Dr. Cantrell.
Oh, my pleasure. Thanks, Kelly. I'll go ahead and welcome everyone. I'm going to go ahead and get the screen share up. It's just such a pleasure to be here and meet with everyone. Let me see if I can get my my screen share going. And we'll try that. There we go. It works. Are some new information about our kids and solutions for daily activities that we have during the day. And the reason I mention this is Finding Solutions, is that there are a lot of things we can do over the counter and with certain special things to improve life, everyday life, without the kids having to suffer from high intensity light and things of that nature. I wanted to, let me see here. Now, of course, I'm not advancing. Just a moment. Let me go back just for a moment. I'm going to have to reset. Let me see. Here we go. Let's try this one. Yeah, let's see. Slideshow. There, let's try this now and see if that'll. There we go. Okay. I spoke too soon about technology. So Terry mentioned grab a pencil and paper. We're going to have a number of things that I think you'll want to take note of that really make a difference in eye health, ocular health. Our kids have long eyelashes. Red goopy eyes is not uncommon. Blepharitis is the actual name of the condition, but it's just really kind of an inflammation that we can manage with a number of over-the-counter products. This is our connection to SOFT, and of course it's self-serving. So this is our son Ryan, and Ryan, as mentioned, was trisomy 18, and he was an amazing kiddo, and is the reason that we are so passionate about SOFT and passing forward what SOFT actually does, which is amazing things. So the summary of our presentation, we're going to be talking about light sensitivity with or without seizures for trisomy 18, 13 and related. It seems to be a common theme. Some new studies that are of recent that are confirming that trisomy 13 can every so often be diagnosed with photosensitive epilepsy, and diagnosis and symptoms, what triggers a seizure, where are the triggers, and how do I protect my child. And then we'll be showing some eyewear, sunglasses, and contact lenses options, some new things that we have to share this year. The last one is eyelid hygiene, hydration, keeping our eyes moist. Our kids don't always blink completely, and blinking is what releases moisture into the eye. If we're not blinking or our eyes don't close completely, the eye becomes very dry and very irritated, very red. So there are special drops, over-the-counter drops that are available, and nutrition is vital. We'll be touching on that as well. So what is photosensitivity, and why does it matter? So obviously, when you're light sensitive, you're having extreme reaction to all sources of light. And it can have a powerful effect on the eye and the brain. We're guessing, and we think we're targeting in on a macular pigment deficiency in the macula, which is ground zero. That's where all light focuses. And our kids are at in a higher risk category. So it's one of those things that we're with years of observation and now confirmation with studies independently, EEG studies, we're able to put a name to it and create some solutions. So the diagnosis, why is it important to have a diagnosis? So our practice, we treat adults and children with photosensitive epilepsy and with other photosensitive seizure related disorders. And those contact lenses have been successful in reducing and eliminating all seizures. So the once we confirm this and the symptoms that go along with it, we can then target medical glasses, contact lenses. Now I know contact lenses is a new feature, and we don't usually use the words contact lenses with our kids. We now can, and they're designed specifically that manage light entering the eye, and in many cases eliminates the seizure activity. It really reduces tremendously, but it can eliminate. And if photosensitivity is present, what do our children experience? What do they feel? What do they exhibit? So painful light sensitivity, with or without a seizure, they can be very sensitive to that. Frowning, just very irritable, can cause a headache and a painful headache, and just uncomfortable. So our kids hang around us when we're on a computer, when we're watching TV. Every screen can be a potential trigger. So we have to be aware that we want our kids around us as a family, but there might be some risks there that we have to avoid. And they can be in happy shopping in big box stores and just out in normal everyday places. Now, I want to welcome Terry Carmichael, who has Andrew. Andrew's here with us. We're gonna let me all about Andy right now. So let me go off. There we go. Can we go to our full screen? Is that possible? You can see. There we go. Good. So here's Andrew. He's trisomy 13. And Andrew is wearing contact lenses. He's wearing the special pediatric lens. We actually had to invent a lens for Andrew. Hi, you? Yeah, you're my brother.
You're the star now, huh?
And so what I'd like for Terry to do is just share a little of her experience and why she was seeking this out. So Terry contacted us, and then that's what started our journey.
Yes. We were diagnosed with myoclonic jerks in the NICU. However, after we were discharged and at home, I noticed that Andrew was having lots of issues out in bright lights. We couldn't go in stores without him having seizures. He couldn't watch TV with us. It was normal everyday things that we kind of took for granted. He just wasn't able to do. So we went for our eye doctor appointment, and we were essentially told he had cortical vision impairment, and he was sensitive to lights, and that photosensitive epilepsy lots of people have, and there's just really nothing they can do. Well, our neurologist, of course, continued to treat Andy with his meds and everything, but we would still have breakthrough seizures when there was flashing lights, LED lights. We had gone through our whole house and changed all of our lights out to LED bulbs to help cut down on the cost, but we quickly found out that Andrew could not tolerate those at all. And we've only we've tried a couple of contacts while we've been in this process, and we've had some neat little glasses for him to wear. But we've had these in for 2 days now, and we take them out at night when he goes to bed. But He is awake and alert now during the day. He's interacting. We've been in bookstores with fluorescent lights. We went to the science museum and he was looking at the fish in the fish tanks. His eyes, he always seemed to squint and be in pain, and his eyes would like go different directions. Well, now his eyes are following what he's trying to look at. They're coming together and not distracted, I guess, by the pain that he felt in his head from it. It's hard with a nonverbal child. You guys all know that. We just have been kind of guessing and trying to use other people's experiences to figure out what would help Andrew and in turn help other kids with the SOFT organization. But as you can see, he is looking at the screen and looking around, and he's just doing great with these. They're really dark. They make his eyes look really big, but that is so cool because it's so much better than him squinting and burying his head in me and crying because he couldn't participate. I mean, he always just seemed to be in such pain, and I don't know, it's just really neat to find something. As soon as I was told, because anybody that knows me out there knows that when I'm told there is no solution, no, we're going to find a solution. And we started, I posted on Facebook, and I was told to contact Dr. Cantrell and talk with him about what we were experiencing, and he's been great with us. It's been, well, I guess we started right after the SOFT conference last year. We did, like right after because I sat down and watched the video for it. Anyway.
Well, thank you for sharing that. But this guy's a ham.
Hey, hi, everybody.
I need my finger.
Ham's got to work now. You got to let go.
Okay. Let's go back to our.
That's so fun.
Get the screen back up. Okay, go back here. Wasn't that fun?
Or I still am as red as can be. But anybody knows me knows that I do that.
There we go.
And Andy got it from me too. The blushy cheeks there. Come on.
All right.
I'll let you stand up.
So thanks, Terry, for sharing that. That's important information and really fun to see that. So the study, the next slide on is the Japanese study targeted to trisomy 13. They did a number of EEG studies with a number of children. That was a major breakthrough. And having been with children with trisomy 18 and 13 for many years at conference, I always felt like trisomy 18 kids were much more light sensitive and much more reactive. It's pretty equal. So there's my perception of that has changed since I've seen some of the studies that have come out that have verified that. So what triggers a photosensitive seizure? Direct sunlight. And that's obvious, but when the kids are out, we'll be talking about ways of protecting that. And the middle slide is when our children are with us on the computer, on our technology, because that's one of the things that will trigger a seizure if photosensitive epilepsy is there. Everyone that's light sensitive does not necessarily have photosensitive epilepsy, but all of the tools to protect our eyes work well to make our kids more comfortable and relieve some of the symptoms. Flashing lights, video games in the dark are really toxic for everybody. The obvious things, strobe lights, emergency vehicles, different settings. Big box stores have rows and rows of very high energy lights that can be troublesome. And so that leads us into how do I protect my child? The obvious answers and the good answers are hats, sunglasses, tinted car windows are very valuable. Indoors, you can close the drapes, dim the lights. The sunglasses are good to wear full time. So you can even wear this if your child is having some difficulty squinting, unhappy around different lights, you can wear the sunglasses inside. That's perfectly fine. Our adult patients that we treat with this particular technology wear their sunglasses indoors and outdoors as well. But then once we're fitted with contact lenses for that particular need, that's no longer an issue because the contact lens covers the pupil, and that eliminates all light entering the pupil for accidental exposure that can trigger that. So wearing sunglasses indoors, outdoors, full time at the store is invaluable. That's very helpful. Nutrition is a big deal. Now, this goes back a long time. Our soft families actually figured this out. We put our heads together. So lutein and zeaxanthin are nutrients in, there's a list of chart to camera, take a picture of that. And the screen on the right has a few other, it's just more of an illustration. The food's on the left. That's a slide from Dr. James Stringhorn at Duke, who we've been looking at nutrition, and Chris Donahue several years ago, her daughter Mary with trisomy 18, she was extremely light sensitive, couldn't go out. And so we began juicing on a routine basis, all, a rich diet in these nutrients, and it reversed her light sensitivity. That's macular pigment. That's pigment that's in the macula. That's the eye's natural filter. It's necessary for the eye to filter these out, but it doesn't store up. And our kids appear to be low in macular pigment. So it's the macular pigment optical density test where we measure the amount of lutein and zeaxanthin. And little Andrew, who was just here, Terry's been juicing those for him, and she's noticed that his light sensitivity has come down. So that's a very safe, easy way that they're tremendous nutrients for so many things. And one of the latest improvements is has been noted with lutein and zeaxanthin is cognitive thinking. So I'm taking an industrial strength drink of this every day to improve my brain. Peggy likes that. She thinks I should, that I need it. So an example of our soft kids. So sunglasses, obviously, on the far left slide, the pediatric sunglasses, larger kids, there's all different sizes are available. This is a picture of Andrew, and that's a picture of Andrew's contact lenses, what they look like in a case. So they we make them intentionally almost the full size of the contact lens. So if the lens decenters a little bit, there's full coverage. So we're careful to make sure that there's full pupil cover, and that avoids any accidental light. And so photosensitive triggers can cause headaches, cause migraines, just tremendous discomfort. You've all experienced that when you're outside in the sun, you know what that can cause. Now, this is a slide that's specifically looking at over-the-counter options for hydration, for cleansing and cleaning around the eye. And I missed one item on here that we'll show in just a moment. So the Ortho K Thick and Ortho K Thin drops are from a company in Colorado called Natural Ophthalmics. They have a thick for bedtime. So when you put this drop in at bedtime, it covers the eye, coats the eye, stays in there better than others do overnight. Those can even be used during the daytime. I was talking to Terry earlier. Her daughter Chrissy has the gold weights in her eyelids to keep her eyes down because there was an incomplete closure. And when your eyelids don't close, the eyes dry out. That's not good. The Ortho K Thin is a daytime drop, so we would use that 3 times a day. the thickened bedtime. So those are some. If you can't get those, Refresh. The Refresh has a gel that's good for bedtime, and that will help prevent goopy, dry lids from blepharitis. The products down in the lower left is the OcuSoft Platinum Foam. That is a closed eye application. So one squirt in the palm of your hand looks like shaving cream. You gently massage that into the closed eye and you leave it on. So that goes deeply in the eyelash margins. That's an antiviral, antibacterial. The Hypochlor, which is the lower left, second picture in, is just all the rage right now. That's also closed eye. So you give a squirt to each eye, closed eye. If it gets in the eye, that's okay. But that is reduces bacteria, reduces viral conjunctivitis and inflammations on a more natural basis. You can't overdose on that. So those are all over the counter, but more likely to find those on Amazon, different online sources. Now, the lutein and zeaxanthin that we were showing before, an alternate way to introduce that into the diet, these over-the-counter Preservision or Ocuvite. Now, you don't need both, they're just one or the other. So what you would do is dissolve that in the formula, and that's perfect. Just do it once a day. That would eliminate the need for juicing. Juicing, I think, may be healthier, but the Preservision is well tolerated. It's been around a long time. You can't overdose on it, and it satisfies the need for the additional antioxidants in the diet that are hard to get. And I think I'm sure that the formulas today are much better nutritionally, but this is also a way to add another level of nutrition to your diet. So that's terrific, and that's very valuable to keep that in your diet every day. That will also reduce light sensitivity. So we've been able to demonstrate that with our soft families many years now, and with our patients in my office, we see that routinely. Let's advance on, and that is our last slide. So what we can do is open up for questions. Now, of course, that good-looking guy in the upper right-hand corner is me with Ryan a few years ago. But we had fun together. We had our show and tells, mobiles, activities. All of those are valuable. Black and white objects are more stimulating visually for infants and for young adults. So whenever you buy a toy, whenever you do something, a black and white is definitely recommended. So Kelly, we could probably go back to the, do I hit the stop sharing? Okay, there we go.
Yeah, did it for you.
All right, good. All right.
I don't see any questions right now. So if you do have any questions, I would encourage you to put them in either the chat or in the Q&A, whichever button is easier for you. Here we go. And we have, how do we start the conversation with our ophthalmologist about the contact lens that you mentioned?
Well, it may be something that we would need to help and assist with that. That's a very unique lens, and Andrew's is the first of its kind. And so if you would have interest in it, let's schedule a Zoom call and we'll chat about it, and we'll see what the best avenue is to work. Most ophthalmologists have not heard of this yet, and most neurologists have not heard of it, but it's something that we can work collaboratively with them to make sure that we order the right appliance. So Andrew is our test patient and our guinea pig. So, and he's been very successful, and he's wearing them. The contact lens, interestingly enough, helps hydrate the eye. You can also put eye drops in directly on top of the contact lens. So we're just beginning the conversation on alternate ways of bandaging the eye with a contact lens. So bandaged contact lenses are common. It's just a regular AccuView, another type of lens. When we need to hydrate the eye, we have a wound that won't heal, we put those on, drops on top of that. If we have mechanical irritation from long eyelashes, things like that, a bandaged contact lens, could be an option to protect the cornea. And then, of course, with Andrew, mom and dad put those in, and we've developed some tools and some other ways to ease the insertion and removal of a contact lens when the kids don't necessarily want to do it. There are ways of getting around that. So we've been able to develop a way to improve that.
Our next question is, what is your recommendation for light sources indoors to mostly minimize photosensitivity?
I apologize. Say that again. We broke up a little bit.
What is your recommendation for light sources indoors to mostly minimize photosensitivity?
Okay, so the old-fashioned incandescent bulbs that are back do not have the same toxicity as an LED. And on an LED, if you have an LED, you want to warm it up and put it on a dimmer, so you can dim the lights. The CFL bulbs, the bulbs that have the little, like they're wound around each other, those are highly toxic. Some of our most sensitive patients, one of our grocery stores here in St. Louis has in their produce section the CFL bulbs, and in the other side the fluorescent tubes. And some of our patients can't go into the produce section. It's that uncomfortable, and they have to stay away. And Target, as an example, when you're very sensitive, you know where your products are, you make a beeline, get them and get out. So the incandescent bulbs, lower wattage, on your TVs, you can dim hit the brightness, dim it just a little bit. That reduces the amount of high energy light coming out of the screen. And then when your child is in the nursery or in their bedroom, just make sure you have a dimmer light, preferably an incandescent light with a shade around it, and one that you can dim a little if you choose. And our adult patients tell me exactly what they do by putting curtains on the windows, putting screens against ceiling lights. Now, interestingly enough, a ceiling fan can be a trigger for a seizure. It's like a strobe effect. And so our patients have mentioned that they cover the ceiling fan. There are covers that are lower, but you can still have the effect. So it's that pulsing effect of a ceiling fan that replicates a strobe that can be a source of trouble. So the kids can wear their sunglasses indoors if they're having, a special issue with it. I think if you include the lutein and zeaxanthin from whatever source over a period of time, we should see benefit. So it should reduce the light sensitivity. And
At first, I'm sorry.
yeah, it took a while. Yeah, go ahead.
No, at first we had to go down to 40-watt bulbs all throughout the house. And I would, in his bedroom, I had like a desk lamp that moved, so I pointed it up toward the ceiling. And it was like living in a cave. I mean, people come over and they're like, "Why is your house so dark?" Well, since we've been using the goji berries and kale, he doesn't have to taste the kale every day, so we're really blessed there. But he gets it, and he is now able to be in a room with just incandescent lights, without his contacts or his glasses. But if we go anywhere that has the LEDs or, like you said, ceiling fans or anything, he still would have issues without the glasses or the
the lenses.
Yeah, that's wonderful. So that Terry mentioned the goji berries. They're dried goji berries. They're in the produce area around the dried raspberries and dried fruits. And
I ordered the bag on Amazon.
Okay.
It's the powder that I just mix in his formula and put it through his tube. So he gets them that way.
so the reason for the goji berries is they're very nutrient dense in lutein and zeaxanthin. They're loaded. So they're one of the highest sources. You can sprinkle them over, you can eat them at home over cereal and salads for your own consumption. But for the kids, they can be juiced and included in that very easily. But so goji berries, I didn't have that on the list, and that's a good heads up.
We have another question. 2 T18 sons here. The youngest, who is 7, has very bad photosensitivity. The doctors just say it's because he has light blue eyes. What can I do? Meds and juicing?
Well, all of the things we discussed. So the proper sunglasses, a diet rich in lutein and zeaxanthin, and when you get a sunglass, you want to get this one that has and this is baby bands. So this is theirs are pretty good. There are some actual medical lenses that we insert that are specific, the same lens we use for the contact lenses. So what they're doing is filtering a specific wavelength of light that triggers seizures. So we've discovered that the ultraviolet light is what tans and burns our skin, is invisible. The visible blue light right next to that is the high energy light. That's extremely toxic. And that's in every one of our LED screens. So TVs, tablets, phones, you name it. The night shift is an option on an iPhone, the blue blocking filter. Those are things that you can turn on when the kids are hanging around you in the evening with the computer on. Have them put their sunglasses on. So they're pediatric sunglasses, special sunglasses with bands that fit around the head. And those are things that there are some of the hospital optical shops will have the pediatric glasses, but you can go online and look for those, especially from the baby bands people. And look, just Google pediatric sunglasses. Some have wraparound temples. So there are things to do. And then if those aren't sufficient, there are prescription lenses that can be made, and we can insert those lenses into any frame. It needs to be a frame that will accept a prescription lens. So that's something we could talk personally about.
Okay. Another question from Starla. My daughter has trisomy 13 mosaic and also bilateral cataracts. They're going in to talk to a doctor about surgery on one eye. She's a type 1 diabetic. Is there anything that she should let the doctor know to have a better outcome?
All of those things. And cataract surgery is very successful. And if there are pediatric implants, I think that would be the surgeon to determine if she's old enough for an implant. So when you remove the cataracts, that leaves a very strong prescription that either needs to be corrected in a contact lens or the implant that goes in the eye. So I don't know if there are tinted implants. So is this child light sensitive?
That it does not say, but
Okay.
I could.
Yeah. So just the usual things, but alert them to all of the health history, and they're going to certainly make every effort to put an implant in once the cataract comes out. And if there is light sensitivity or photosensitive seizures, I don't know if there's a tinted implant. I'll have to check on that. I don't know.
Said that she's not light sensitive.
Oh, then no, just the regular procedure should be just fine. That's wonderful. So I think just all of that information will be enough for the surgeon to make a decision.
Our next question is, can photosensitive epilepsy be associated with someone with Lennox-Gastaut epilepsy?
I don't know. And so I would ask the questioner to email me with that question, and then we'll begin to dig into it. Unfortunately, with epilepsy, there's not enough information. Epilepsy we don't have a lot of good information. And we're working collaboratively with Massachusetts General in Boston with one of the neurologists, and her comment often is, we just don't know. And we're finding that there are a lot of themes and variations. And I think that if you exhibit the symptoms of light sensitivity and you have a seizure that's related to being in contact with bright triggers, then it's a photosensitive seizure disorder of some kind. Now, the therapy for those are a little bit different. So when I discuss this with our patients, when we talk about symptoms, we discuss what causes trouble, what do you avoid, and that leads us to a decision on which contact lens. So it's not a one size fits all. We have to pin that down with conversation.
Okay, I've been using eye salve at night with my daughter. Is there a reason I should be using a thick drop instead?
So say again what we're using at night.
An eye salve at night.
Okay.
But is there a reason that they should be using a thick drop instead?
Yeah, well, yes, I prefer it just because it stays in the eye overnight. So the way our tear function works, when we're sleeping, the tear glands refill, blinking releases moisture, and then by the end of the day, the tear glands are out of moisture. So while we're sleeping, they're refilling, but nothing goes in the eye. So if we go to bed bone dry, we wake up much drier, and that can build on itself. So drops during the day are very beneficial, or a drop first thing in the morning. A thick drop at night, I like a lot. It's not so thick that it's uncomfortable, but it really is soothing, but it keeps the cornea healthy. So when we're not on a computer, so this is information for mom and dad, we blink 16 times a minute. That releases moisture. When we're on a screen, our blink rate goes down to 4. So it really goes down. We stare at our screens. It's involuntary, but our eyes dry out. So all of us that are on screens, and I think that would much be 100% of us over this last year or two, is we need a supplemental drop. We're going to get dry eyes. Mid-afternoon, evening, we're just going to be dried out. So it's necessary. And so those same drops we're putting in our kids' eyes, mom and dad can use them too. It's highly recommended, and it really prevents a dangerous dry. Our eyes get too dry, overly dry. Terry Krotzer's daughter, Chrissy, has terrible scarring on her corneas because her lids weren't closing, and she has the gold weights to pull her lids down. And they're battling that. So they're looking into options and alternatives, but we need to have those eyelids working and the tear flow, because it can be dangerously dry if we're not careful. So yeah, I would recommend it.
We have 3 questions that deal with sunglasses, just recommendations for types of sunglasses, and specifically recommendations for types of sunglasses for larger children.
Sure.
And also, and I'm going to add this one on, and also glasses for larger children who are having seizures.
Oh, sure. So the baby bands, let's start with the infants, the baby bands for infants. And Terry, you didn't bring those pink. Oh, that's okay. No worries. Oh, that's okay. Terry had one of our show and tells.
And I forgot it.
50 lashes. So the Ray-Bans are a good over-the-counter sunglass. You want to wrap. So the Oakleys, and you want to look at the Oakleys that have more of a blue lens, and you want it dark. And so for the larger kids, so there are sport frames that wrap very tightly around the eye. Lenses can be. This is one that the older kids could have. This is a line called Spider, and it's for an older child. And the Oakleys and Revo, REVO, makes some of the highest quality ophthalmic lenses that have the bluer with an anti-reflective anti-glare coat on top. And then there are sport bands. You can put an elastic band around the back for the older adults. And then the headbands, there's a lot of good headbands available, just like for the baby bands. There are some available for frames like this. So feel free to find a frame, email me. I'd be glad to share my 2 cents, and we could find an answer. And I'd be happy to do that.
And then we have, what makes the decision for glasses versus contact lenses for infants and children? And in addition to that, what conditions of the eye causes a child to have surgery?
Well, so the discussion, now the contact lens discussion just began today. So that is very new technology. We've been working on this with Andrew for about a year. We have an outstanding laboratory, and that is able to replicate our choice. So we formulate the actual filter tint in the lens. We size the pupil. So it's a very custom lens. But the decision to do that really has to do with, are the sunglasses working? And the sunglasses can be perfectly fine. If that's adequate and doing a good job, I would certainly recommend that. The contact lenses are a next step, and that's a larger step. But for the first time now, we have them available for our kids. So our children with trisomy have different eye topography and lid alignments. And so we were able to design a lens that has a steeper curve, fits the eye more tightly, and is comfortable. So if Andrew accidentally fell asleep with his lenses and they woke up the next day and we still had contacts on, he'd be okay. The lenses will last anywhere from 6 months to a year, and it's a personal choice. So it's something that mom and dad would insert, remove the lenses, but it's a new choice that we've never explored before. And again, this is just my desire to find something, because this photosensitive seizure disorder is common and now proven in studies for our kids. So it's just another tool, another option.
Okay, and then another question. Do lubricant drops and allergy drops help if eyes feel inflamed from droopy eyes while sleeping, the sensation of feeling swollen or inflamed with eyelids for allergy sufferers?
Oh, sure. So the products that I mentioned and in the slide, the hypochlor and the foam cleanse and clean very nicely in and around the eyelids. It removes that. Now, one other thing I forgot to mention. So write this down, everybody. This is OcuSoft baby pads. They're pre-moistened individual pads, and these you can use to cleanse and scrub around the eye. So this is the foam we were looking at earlier, same manufacturer. So just look up the OcuSoft items because they're very safe. You can't overdose. They're not offensive, and you can use them every day. And it removes the irritants that can cause an itchy, scratchy eye. Now, if you have allergies, for sure. Now, the other thing is, if we're taking decongestants and antihistamines, that dries our eyes out. So we need to add moisture back in. Natural ophthalmics makes, I don't know if I brought it over here, an allergy. Yeah, here it is. So that's the natural ophthalmics allergy eye drop, and that's the Ortho K thick and thin. But the allergy drops you can't overdose on. They're non-toxic, but it reduces the histamine release and reduces the allergy symptoms. So this is one, the natural ophthalmics allergy, very safe to use. I would recommend that. And if they're a little goopy, itchy, sticky, use the foam and the spray that we mentioned earlier, the OcuSoft products, because those are proven to create a very healthy environment. All of the things we're discussing are just to make life at home a lot more comfortable. So if we can reduce some of the irritation and some of the seizure activity, some of the light sensitivity, everybody's happier. So it's really more for family time that it just enhances and creates.
Okay. You froze up for a minute, so are you back with us, Dr. Cantrell?
I am, yes. Okay,
Okay.
I'm
good.
here.
All right. I don't see any more questions in the Q&A
Okay.
or in the chat.
Now, I'll kind of chime in a little bit. You had mentioned that during Deborah Brunn's presentation, someone wanted to ask about eyelashes that were turning in. It's an entropion. And I'm not sure that person is listening right now, but that is possibly something where a bandage contact lens would work, because that would protect the cornea from the eyelashes. The kids have long eyelashes, and what you want to be aware of is look at the eyelashes in the morning. If they're turning in, take your finger and just get in the corner of the eye and kind of redirect them out. So the lashes can kind of stick together like Velcro. And I know nobody wants to trim the eyelashes, but it's perfectly okay to do that. Still have long lashes, but you could trim them, make them a little shorter so they didn't kind of stick together. But managing longer eyelashes, which is common to our kids, and they're beautiful, is just making sure you redirect them, get them out of the corner of the eye, out of the edges of the eye. That will help in a number of different ways. So that will work quite well.
All right, Dr. Cantrell, I want to thank you so much for being here with us today. We always appreciate your presentations and all the information that you share with us.
My pleasure. Okay, thanks everyone. And we'll see you again at the other events. Look forward to it.